specific youth client level. There's a mezzo level data, if you will, that involves the monitoring of program outcomes and where the learning is specific to the practices or the modalities and the interrelated work. And then ultimately, the impact is in terms of community, right? And really recognizing that the deep end data on the back end is where the learning occurs for systems and where we adapt and move our systems forward. It's important to recognize the complexity of this work. California has made many attempts over the last 3 or 4 decades to move the needle on data. And it's such a complex task that we've typically, I think most people would suggest that we've made very little headway in this regard, at least as a state. The final reflection for me, I think, and then Steve will give us a little more context, involves, again, just orienting to our approach here. We've done a conversation on shared leadership a couple months back today on shared data. We hope you'll join us in August and then again in October for the final 2 segments of our Masterclass series on shared resource management and financial connectivity, and then ultimately on impacts in community and how we can move, again, the power from public systems into community impact. There are a host of resources available at the breakingbarriersca.org website. And we hope you'll avail yourself of those if you have not done so, including the prior recordings from these master classes. Steve?
Yes, thanks, Richard. And try to set a context. This flows out of what we've been learning in Breaking Barriers in the annual symposiums and the work in between, that our goal is to have one child, one plan. That right now we have too many siloed plans and too many sometimes overlapping, sometimes duplicative, and sometimes competitive service plans and engagement with the young people, the children and their families. And our goal here is to begin to move closer to a more integrated system where we have one child, one plan. Our values that you're seeing in the yellow and the blue box there are that we're looking for this to build upon what we've already learned in 25 years of system of care work, is that this should be youth and family led, that given all of the disparities and equities that we've come to see so blatantly over this last year or two, that our work needs to be grounded in equity and justice, that obviously, especially in a state like California with such diversity, that we need to be both culturally and linguistically responsive so that people can participate fully. That while we're all public sector systems or providers or researchers, that ultimately people are born, live, and die in communities. And we want to make sure that our communities are responsive and supportive of this approach to health and well-being. I heard someone recently say that instead of being mandated reporters, we ought to be mandated supporters of the health and well-being of our children and families. And clearly, to undo many generations of deficit thinking, that we obviously need to be strength-based. Next slide, Richard. Now, as we've learned and taken in the information from both communities and stakeholders and researchers and the literature around the country, we think that these 10 steps that we've gone over before, and again, for a deeper dive, you may want to look at our first webinar that really went into each of these more specifically. And obviously for today's event, we're really excited about the 3 experts we have here. We're calling them masters. The 3 masters we have from different perspectives on how to collect, analyze, and manage data so that we can have a continuous quality improvement approach that we're going to constantly be learning as both children, family, and our social circumstances continue to change. Next slide, Richard. So again, when we're starting in terms of integrating systems or beginning to create more comprehensive and collaborative systems, that steps 1, 3, 5, and 7 are the first priorities. You need to be grounded in the governance and the leadership, and but that 2, 5, 7, and 10 are very dependent upon data. And so what we've come to appreciate is that data answers 2 profound questions. How well are we doing, and how do we know it? And that we're looking to a focus on three key ideas: the historical efficiency and effectiveness, but now obviously also trying to address equity. As Richard was talking about the micro, meso, and macro level, yes, we want to make sure we achieve what we intended for the children and their families. We want to make sure we did it in an efficient way in terms of the meso, but we also want to make sure it's equitable. Did we make a difference both to the children and families as well as the community circumstances? Because we know that some things happen to people that are beyond just their circumstances. It's where they live and work. Systems data, it needs to have, we need that client-specific information if we're going to have comprehensive care delivery and coordination. And what we're looking forward today with our three experts is to begin to highlight how we need to collect, monitor, and analyze both clinical and administrative data. So that, and that always is a responsibility of joint governance. We all know of the regulations and legal barriers and, HIPAA, FERPA, we've got a whole alphabet about why we shouldn't communicate and share. But we also know that the more we can work through those differences and begin to share, that we can have share the data, that we can have comprehensive and successful interventions so people have an opportunity to live a good life. And that is a collective responsibility for all of the stakeholders in a community. Yes, it's the lead of the public systems, but it's more than that. Richard?
Steve, thanks. Very quickly, just for those of you who process information and data graphically, this is a quick attempt to just reflect the organizational imperative, right? We'll never effectively utilize our resources and serve kids and families if we don't figure out the data sharing and the outcomes evaluation process. So just a quick look at the fact that this all revolves now in California around the Assembly Bill 2083 Interagency Leadership Team, as it's reflected here in the triangle blue in the center, and that the circularity and feedback loops necessary between data collection, evaluation, and how we use those resources that come from federal and state sources is the critical systemic organizational imperative. With that, would love to invite our master guests today to self-introduce. Thrilled to have Kate Cordell with us, Karis Grounds, and Daniel Stein. Let's start with Kate and just invite them to do a little bit of self-introduction. And at the same time, as you do that, if you can briefly, maybe give us a highlight about what your current focus is, where you're energizing most around this idea of shared data. If you can give us just a couple minutes each. Kate, good afternoon.
Thank you. Thanks for having me. I appreciate that, the invitation to be here as part of the masterclass. So I'm Kate Cordell. I have three roles. I've been a consultant to the state of California for the last 10 years through my consulting, Mental Health Data Alliance. I am also an assistant professor at the University of Kentucky in the Center for Innovations in Population Health, where I do research on trajectories of resilience and recovery. And then finally, I'm founder of OPICA, which looks to unify the system of care so that we can look at those trajectories from a whole person perspective. I am energized right now around unifying information to create a whole person story. So we are not dissecting families and people into various parts to go off into various systems, that we're unifying that information back to a whole person and a whole family. So I spend most of my energy around that. And then once we have that, performing the research to look at what is the trajectory of recovery and resilience look like for families. Thank you.
Karis?
Hi, I'm Karis Grounds. I'm Vice President of Health and Community Impact at 211 San Diego and the Community Information Exchange. For those of you who don't know what a Community Information Exchange is, it's a community-led initiative that's really looking at multidisciplinary network partners, sharing information and using a shared language, resource directory, closed loop referral through an integrated technology platform to essentially support our community in providing more of community care planning in a person-centered model. Similar to the way Kate was alluding to the fact that I think the opportunities and the excitement around shared data is really the person-centered care work. But I think about it as Steve and Richard were just talking about it from a micro, meso, macro standpoint, in the sense of helping an individual, and then looking at supporting organizations and sharing information to make better decisions for programs and supportive services. And then as a community, looking at data to help address the disparities and some of the structural systemic issues that are happening within our communities around race and poverty and other socioeconomic indicators. So I think the excitement is the opportunity to kind of start making better collective decisions to support those most in need.
Welcome, Karis. So glad to have you with us. Daniel, good afternoon, or good evening, actually, for you.
Yeah, it's Miller time. For those of you who know that reference. So I hail from Long Island, New York, an hour out from New York City, right on the North Shore. And it's a beautiful summer day. And thank God we've had a lot of rain the last couple of months. I was talking today with people about shipping it out to you guys, but feel your pain. There's so much to say. Thanks for inviting me to join. I have a lot to say, as anyone who knows me will know, but I'm really delighted to be part of the conversation because it's been part of an ongoing conversation that I've been involved with both in California and nationally for the last 15 years, and have a lot of history in this and a lot of investment actually in seeing the work come together, like unfortunately glacially slow in some respects, and on the other hand just remarkably fast. So things happen in different ways, and it's been really exciting and a lot of work, but to have the opportunity, created the opportunity to be able to look across the country and to see different jurisdictions at the local level, at the municipal level, at the county level, at the state level, the regional level, at the regional consortium level, different parts of the country, doing this work, and surviving political turnover and sort of picking up the pieces and moving it forward, hopefully, and maintaining consistency. We talk about maintaining consistency and sort of sustainability. Well, it's really amazing to watch this work evolve from really the Affordable Care Act, and before that actually from the Bush administration, our electronic health records, they launched that. But if you have a long view of it, it's growing. I'm still doing the work, which means I'm still optimistic that there's a possibility of change. But we need to do it now. And last thing I'll say before I shut up is, for a moment at least, is at a systems level, and a lot of work that I've been involved with and learned from San Diego and Santa Clara and Ventura and Sacramento and Alameda, all these places have been on this road. So a couple thoughts. One is, I don't know if California is still yet connected, and maybe Breaking Barriers is sort of attempting to do that with others, but I remember that the counties didn't even know and didn't have a mechanism for sharing amongst yourselves. And I suspect that has moved a little bit, but not as far as many people would wish. So there's so much stuff happening in California, but you guys haven't figured out how to connect it yet, along with the rest of the country. But I guess what I wanted to say is that there is an arc of this work, and that, in my opinion, the thing that I'm focused on, and I think we as a nation need to be focused on, is the next 18 months and what we can demonstrate and what we can get done that leverages the administration and the investments the administration is making in all of this work. All of this work is all written in all the federal documents, CMS documentation, the ACF documentation, SAMHSA. It's all about social determinants, all about connecting. The language around interoperability is pervasive. It's part of the Office of the National Coordinator. So it's there, it's happening. But people are taking divergent turns, and they're thinking about things beyond 2 years, which I think is a dreadful mistake. There's so much momentum. If we can figure out a way to leverage that, and that means, and this is what I'll talk about later, what are the few structural things we can do that can be replicated across counties and states and regions to say this works and it deserves to be built into the federal laws and the federal engagement and the federal regulations that allow states to blend the funding streams in the way that you need to do in order to provide coordinated care. Because right now everybody's fighting the silos of funding. Anyways, I'll stop there for a bit and hopefully set a few provocative things to get some people to ask some questions.
Daniel, Kate, Karis, thank you so much for that. And indeed, there is much to talk about, and we know that we will only scratch the tip of the iceberg, so to speak, in the next 35 minutes or so that remain. We appreciate those of you as participants who sent in some advance inquiry around this. I will reflect back that many of those questions were of a nature that was more legalistic or technical. And so those questions may or may not lend themselves to our conversation today, as we're really talking about linking largely data systems and how to bridge that, as opposed to kind of digging into the more granular aspects of the legal impediments or the technical essentials of how you do that locally within your own system, if you will, because we got some inquiry around, well, how do we do this locally? And I don't know that we'll get to explore that. But that being said, I want to invite maybe Karis to reflect first on some iteration of this first question around, do you in San Diego have a shared data agreement for your partners that really allows you for an effective use of performance indicators or outcome data, and that allows you to begin to approach this idea of shared decision making? What's that look like for you? And can you reflect a little bit about your experience in San Diego?
Absolutely. So I can share, as I mentioned before, our initiative locally and being replicated nationally is community led, and that is kind of the infrastructure is based through a stewardship kind of governance model that's led by an advisory board made up of well, Steve is on the advisory board, but many other people, so including our hospital association. And other community-based organizations that are kind of supporting the network and kind of stewarding what information is being used and shared. We also have network partner meetings that's made up of our over 100 partner organizations that sign on by joining, by using an agreement. So we have a participation agreement, a business associate agreement, as well as an opt-in model that allows for individuals to choose to share their information. And so that full infrastructure is really built into our stewardship governance model. We want to make sure those shared decisions are being met and led among those organizations that are a part of it, as well as the community members that are agreeing to have their information shared. So we do have shared agreements that we leverage. We actually published a toolkit that's available on our website that outlines what those agreements look like, as well as our authorization that can be leveraged for other communities. And that is, again, linked to kind of the shared data that we're collecting and measuring. And those metrics are defined by our organization, our stewardship structure annually. We look at some outcomes data. Again, we're moving slowly from outputs to outcomes to be able to really measure the impact, knowing that this is systems change work and it takes a long time. So those goals are defined within that group annually, and that's kind of how our infrastructure to be able to kind of measure those processes over time. And I will add the link into the chat as well.
Karis, thanks for that. Really quickly, how long did it take you to pound out the first data sharing agreement? And if you could reflect back on that for just a moment, is it possible to identify maybe, was there a key strategy or tactic that you and your partners took to get to the finish line on
that? Data use agreement. I think that took so again, we have a partnership agreement, business associate agreement. Those took months, and then also our consent, I think, has also been kind of a process as we've married it or created joint consents with many of our other providers in the community. And those data use agreements, I think, have been an evolution of building in the sense of I think data ownership data governance becomes more and more important as we think about how information is being used and shared and what policies are in place. So I definitely think nothing's set in stone. I still think we make adjustments and additions as we know how do we prioritize the community. And I guess that would be my suggestion, is knowing that, things can be iterated, and that how do we continue to ensure that the community members' voice and the use of that data is authentic and validated. And so I think we're continuing to figure out how how to center that and what that means. And so knowing that it's an agile process and it's not going to be perfect the first time. And so how do we kind of continue to add amendments or additions that kind of, or policies that really instate some of those pieces that are really important to center that voice.
Thanks for that. And thank you for putting into chat the link to that example. Kate, what's your sense about a data sharing agreement? You work with clientele who are struggling with this. Do you have any reflections for this group around how to make that real?
So I would say that a lot of times there are technology barriers to sharing information. I think Karis spoke to, folks agreeing around a table with a document to share. And then after that, there's the means of sharing, right? So how are we going to actually operationalize the sharing of the information? For how long? What happens when the information is no longer useful to the second party? What do they do with that data? Do they destroy it? There's all kinds of agreement in those documents that then needs to be operationalized in some way. Is it a mailing of information? Is it electronic sharing of information? What's the format of that look like? And so I think the agreement is definitely the first step, that we need to remove the technology barriers in the steps afterwards and really operationalize how that's going to happen. Or we have the potential standing behind those barriers and saying, well, we agreed, but it just wasn't possible.
Yeah, thanks for that. The last year or so has highlighted for me in a number of conversations with some of my thought partners that not only do we have to iron out the technological connections behind the agreement, but on some level, those technological connections can be the solutions to the obstacles within the agreement. That is, the digital solutions actually might help us get to the finish line quicker than we could otherwise from an approach maybe that was 10 years old, like where we didn't have some of these tools. So I love that reflection that there's a connection between the sharing of data and making sure that technological barriers can be minimized and utilized as a bridge. Daniel, you work with many experts around the country on data agreements and back-end data sharing. What would you reflect here for our folks this afternoon?
So two things come to mind. First of all, the data sharing agreement, there's a lot of them out there, and there's a couple that have been widely adopted. So we worked with Illinois when they were putting in their enterprise APD to the federal government to try to connect all this stuff. And we spent some time working with that. The state of Virginia, the Commonwealth of Virginia, apologies, took that agreement and morphed it for their county-based approach. And then Mike Wilkening in California took that and spread it across HHS and was able to share that broadly. And so there's a model at a macro level that I believe is also applicable, because it required all of the agencies to actually sign on to it and contribute some money towards managing the personnel and the infrastructure and the governance. Governance is expensive to do, so everybody had to contribute to it. So I suspect that many counties and others have seen that. I know Dash has taken that and sort of created it for its community, and others have built on some of those models. So that's one thing which is really great, but I think it's only a starting place, because data sharing agreements, it says, okay, go ahead, we're going to share. Getting people to the table to actually share is a whole nother conversation. And the thing that I would want to share with folks around this is actually just a conversation I just got off the phone with a group out of the National Interoperability Collaborative, which is what we've been doing the last 4 years under a grant from the Kresge Foundation to try to bring people together who are thinking about these things and put it there, in cyberspace. And so we've been really focused on that a lot. And last year, COVID year, we spent a year not doing an in-person conference, but we brought about 200 people together from across the country to say, what is going on? First of all, it's COVID. And secondly, so it turned out to be sort of an interoperability support group. is the way we termed it. So people could get together and talk about what they were doing and what we should be thinking about doing after COVID in January. So we actually picked a day in January. And so this was an amazing process. People from all over the country participated, and we set a couple of several goals, which was the first one was actually, what are the 2 or 3 things, what are the 2 or 3 recommendations to go do? What should we go do starting in February of 2021 that would have a structural impact on the country? Because the whole country is on tilt now, right? Everything is cracked and fragmented, which is a terrible time, but it's also a wonderful time to actually make change. And so we came up with, actually, believe it or not, I don't know how we did it, but we came up with actually 6 goals. And the one that we landed on for confluence of reasons is about leveraging work that has been done already out of SAMHSA, something called consent to share, which is for behavioral health and 42 CFR, and the work in San Diego, because they were gracious enough to put their code up on GitHub to do consent. So there's a working group that's looking at creating an open source, open API, open standard, or standards-based consent to share utility in quotation marks, in the sense that the fundamental issue with one of the fundamental blockages for interoperability is not the technology. Everybody will say that. It's not the technology. It's the ability to get consent to share my data. So 99% of the privacy and consent issues go away, privacy and confidentiality issues go away, if you can get the person or the guardian for that data to say, I consent to share my information. Everything is gone. HIPAA, FERPA, 42 CFR, and a bunch of other state codes almost evaporates. And yet we're working now, so it's become, like many things, it's become very proprietary. EHRs and hospital systems and hospital groups, and all the CBROs, the NowPows and all those guys are creating their own silo to manage their consent that they gotta buy if you want to do it. So there's a working group that is actually creating a utility, the first version of this utility that would enable, on an app-based solution, to be able to actually get people to provide their consent, which is at the, one might say, center's equity, because it's saying,
Daniel,
are you sharing your data with me? Parenthetically, most people will say, you bet, please share my information, please share it. I expect you to be, as government, to be sharing our information. I get really worked up on this, sorry. But
yeah, Daniel, hold on a second. Daniel, there's a question in the chat.
Okay.
Will you put the links in either now or afterwards for the templates that you mentioned in terms of Virginia, Illinois?
Yeah.
As well as the link to the link that you're creating in terms of the utility. And I didn't mean to cut you off, but I did want to make sure that the participants had an opportunity to ask questions to each of you. So,
great.
The way we've done this in the past is if you would raise your hand, we'll have oh, yes, thanks, Jamie. Put it in the chat box and Jamie will direct it to the right person. But we want to make sure that this is interactive, to build on what Richard said earlier, that this is really how do we begin the dialogue? Because as each of them has said, this is an iterative and process that's going to be over time. But we do have a unique opportunity at this period in time. So questions? Well, while you're thinking that, Kate, is there, what's on the horizon for data sharing so that information and data can be accessible and actionable?
Yeah, and I'd be curious to see what are the audience's biggest barriers. What do they perceive as the biggest barriers in the chat as well?
Yeah.
Yeah. So on the horizon, from what my lens of the world, I'm focusing very much on the technology barriers for data sharing, so that the utilities that Daniel and his colleagues are building for consent can easily and quickly be integrated into all those siloed information systems. So if we have the consent and we have the data, how do we store that in a place locally that we all feel comfortable that the consent has been completed and that the data can be shared in a way that's reproducible, that's high quality, that's secure, and also that has a timestamp on it if necessary, so that that sharing ends when appropriate, and that there's not data left out there that no longer has an agreement associated with it. So on the horizon for the work that I'm aware of is an ability to do that in a way that will simplify our ability to share data between different siloed systems. And so I think that hopefully, I hope, you know, in today's day and age, we should be able to share data. There's no reason why we can't. Electronically, it should not have to be mailed. And while there are some electronic systems that are a bit antiquated, there's still the ability to do secure file transfer in regular ways with that consent on file. Of course, then you need to operationalize a process electronically for that to occur when necessary, but not occur when not approved.
Okay, thanks for that.
Thanks.
Patrick is inquiring a little bit for a little more clarity. I think what's the unique opportunity? I think this reflects back to Daniel, maybe in what one of the things you were referencing. Daniel, could you give us another 60 seconds on what you see as the uniqueness of the moment?
So there's as I said, there's you know, from a macro level, there's a confluence. So, and there's things that can, I think at this moment now, at every level, move towards, take a significant steps towards connecting, if there's a willingness to really sort of learn from each other, right? And if there's the ability to collaborate, which is a really easy word to say, and it's like super hard to do it. So,
appreciate that.
Yeah.
And maybe part of the answer to that additional, the power of the moment is that there are significant one-time or short-term funding opportunities, both federally and within California's systems for infrastructure development,
Right.
particularly in the children's mental health world, associated potentially with some of the juvenile probation reforms or the Family First Prevention Services Act. There could be opportunities. The devil's going to be in the details of how those dollars roll out, but I suspect there is enough flexibility, at least in some of those areas, where some resources unique to this moment in the evolution or adaptation of our systems of care in California might avail themselves of building architecture that would actually help solve some of these problems going forward, if that's possible.
I think Richard, to add to that, I think it's also that the time has come when we realize siloed service plans are necessary but insufficient, and so there's this whole push around whole person care, family-centered care, and so that you need a wider range of information if you're going to make the best possible choices for the folks.
Yeah, in fact, really, you won't get to one child, one plan if you can't share information across systems. Obviously, right? That's the starting off place. Kate?
I was going to say, if I could add a visual when you said infrastructure, I picture super highways between those silos with your stoplights, red light, green light in between, so that data can flow. That's what I'm picturing, and I think that we can get there from a technology standpoint with the stoplights being those consent forms.
Yeah, thanks, Kate. And that reflection reminds me that some of that experimentation and development is going to happen locally. You know, Karis and her partners in San Diego are certainly championing that, but the state has been, you know, Daniel referenced the work that Mike Wilkening did before he left agency, and the larger that those systems are, the seemingly less flexible they are, and the more challenges they have around actually making that superhighway connect to itself. But locally within county systems, often the dexterity is present, so that we can begin to beta test some of this stuff and again, make it harmonized in ways that work to support our service planning and outcomes evaluation.
Richard, if I might add a thought here, because everything is connected, right? And it has to be connected in order to get any synergistic effects. Part of the problem, which is a really hard problem, is procurement. And so everything we've said is true, but the procurement systems we've set up because of public accountability desire and need and complaining requires these really stringent procurement rules, which are very slow. Even the agile ones are terrible. And we've structured them in silos, of course. So there's a concept I learned last year through the National Academy of Medicine and Science. They had commissioned a group to look at procurement as a interrupter, as a hurdle for interoperability. They've done a bunch of work on interoperability and SDOH, great sources at the National Academy of Medicine, really good stuff. But the person I was working with turned me on to this, what it was called, I don't remember the exact title of it, but it was basically enterprise level procurement for interoperability. So it's a white paper that talks about how systems have to procure technology for interoperability differently, ergo a systems approach. Because if you buy it one piece at a time and try to buy all the middleware to link it together, you never win. It never works. And we know how much money has been spent on things that haven't worked, or marginal returns, or returns are not back yet. So that's a really hard question. Bloomberg attempted to do that in New York City. They reformed the contracting vehicles with all the NGOs. They had about 30 agencies, private agencies, like California, to deliver foster care services. And they at least standardized how you contract with the state. So if you had more than one contract, because you did foster care, you did in-home care, you did other stuff, you only had to fill out the one form, and then this is for this, and this program, as opposed to filling out, 5 or 10 folders that big with procurement. So I don't know where that lives, but it's a huge barrier along with consent. If we can scratch at it. And one note, this is fun stuff. The Native American communities got a waiver on statute 477, which allowed them to blend funding and report to the feds one time. And so for a number of 3 or 4 different programs, they could take all the money, put it into a pot, and say, here's what we did with it. So I've always joked that we can really use that. And actually, Alaska used it. It was a brilliant template for doing that kind of procurement, which I don't know if counties can do that. I don't know. I bet they can. Yeah.
Well, I think Patrick is saying, can we get the paper, and then we'll figure out in California how people can advocate, if that makes sense, to move it forward. Because what I hear is that you want to reduce the administrative burden to make good use of data.
Absolutely. There's, Deloitte did a report a couple of years ago that talked about 80% of the budgets, up to 80% of budgets are duplicative. So even if it's 10% you could reduce, it would be huge. Anybody who's dealt with procurement knows how painful it is and how slow it is.
Yeah.
It's, again, waiting for others to bring forward their questions. I wonder, Karis, if you would talk a little bit about what's been your experience with CIE in terms of community-led. What did you have to reach out to do? How did you get them involved? What's the feedback you're getting, and what do you see as the next steps?
Yeah, and maybe I can kind of, as Patrick mentioned, the breaking down of statewide efforts. I think that part of the benefit of that, the community-led, locally owned concept is definitely harder, and it requires a different type of stewardship structure that might not be one size fits all. That I think there's a lot of lessons learned, like to Daniel's point, like we don't want to duplicate efforts, but there is something about being local and knowing your communities. And I think a lot of the work around social determinants of health has been the assumption that systemic issues that have been rooted, like there's power dynamics at play here. There's infrastructure elements that social services don't have capacity to step up to some of the expectations around what the healthcare, government, and others want to be able to respond to. So I do think that some of this, the benefits of being community locally stewarded and owned has made us be successful in the sense where we started the CIE many years ago and have continued to evolve and grow with the needs of our community and allowed us to be interoperable and have access to data that is trusted and I think supported and is kind of the vision I think of where most people want to go. So I think that's been a benefit of being kind of locally and community stewarded in the sense of we have many stakeholders at the table that are helping to make those decisions. And when state legislation comes down, we can make decisions based on what our community needs and what infrastructure. Instead of building 100 pools, we've built an ocean. And so let's, leverage that infrastructure to be able to actually make tangible change in our community. And so I think that's been a great opportunity for us.
Karis, thank you for that. Two inquiries in chat that we could probably follow up on. This may begin to get us close to the top of the hour, so appreciate your patience. Amar, thank you. Your school district partners have had a conversation with a vendor, Unite Us. Are any of our masters familiar with Unite Us? That's a yes or a no. And then if you could reflect on that, in terms of process, there are dozens, if not hundreds of vendors out there that will sell you products. Very quickly from Karis, Kate, and Daniel, if there is one thing to be mindful of as you approach a vendorized relationship on a solution here, what is that one critical thing?
Am I starting?
Sure.
Do you guys use it? You don't use it either, any of those, right, Karis?
Oh, no. Yeah, no, we have our own custom platform on Salesforce, but I know Unite Us and to Richard's point, many of the other vendors that are in this space. And I think our biggest takeaway is just, the technology should be the last part of the solution. You're first thinking about what your community's needs are and building that capacity and environmental scans, assessing what you already have in place before selecting a vendor. And so our lesson learned is really around what are we solving for? Are you solving for a bi-directional referral platform? Are you solving for data sharing and system change? And then what type of technology platform do you need to address that problem? So reverse, instead of assuming the technology is your answer, the person-centered care and the people are the question at play. And then the solution should be
beautiful.
That last step.
Well said.
Thanks, Karis. Kate, quickly, any suggestions for approaching a vendor?
I think you just need to make sure, I think, Karis hit it on the head that it's going to solve your problem. So, and make sure that they're listening to what the problem is you're trying to solve and not giving you a solution that'll solve the problem they've designed it for. Make sure you have that problem that the solution is trying to solve. And then just I think Karis said it perfectly, just be very mindful of what it is, be purposeful about what it is you're trying to do, what the needs are in your community. And then my other thing would be, don't ever go with a vendor that tries to boil the ocean. If they say they're going to solve everything for you and it's going to take 2 or 3 or 4, years of implementation because they're boiling the ocean, that you'll never get there. You've got to catch it one fish at a time. So if the vendor can't produce something and have it visible and have you up and running with at least part of your solution in weeks, then I would move on.
Thanks for that, Patrick. Thank you. Obviously, owning your own data. So make sure whatever agreement you end up signing with a vendor doesn't relinquish fundamental rights to your own data. Fantastic reminder there. Daniel, 60 seconds on what to do if you're approached by a vendor or where to focus.
Yeah, I think the other question for Patrick would be, how much is it going to cost me to get my data back? Can you negotiate that? Because I don't think you're going to get there, which is the problem with it because it's a proprietary data model. The question I would ask is, how are they going to exchange data with all the other partners? Because you're going to have Aunt Bertha, you're going to have Unite Us, you're going to have some local variants, you're going to have a 211, and we got to make sure we're not creating more silos. So, and I know they're working on this sort of the cross CBRO data sharing. But until they get that, nobody should use, in my opinion, nobody should use any of them until they figure that out. Or otherwise we're stuck with another EHR.
Good point.
I see
We'll go to Karis and figure out how they did it so that it's community driven and locally stewarded.
Well, that's the idea that's the idea of the utility, is
Right.
to build it once in San Diego. And that's the great news from San Diego, is that they've invested over 15, 20 years and have been very generous with pushing all their information out over the years. The question is replication. Is it replicable? And how do we focus on replication as opposed to, everybody wants to do their own thing and create their own system, and they got to give up the
power.
That power in a way.
Daniel, thanks. I wanted to very quickly give you, let's go to just Daniel for this alone, on Patrick's earlier question about how do you get to bite-sized chunks, because the statewide effort seems to be so unscalable. For context here, in California, the Office of Health Information has been in pursuit of a universal consent to release information for a couple of years. And it's a fantastic effort, but we're years into it and still awaiting what is a fundamental need. So Daniel, can you give us 60 seconds on maybe bite-sized chunking this? Is there a strategy to get to a progress?
Absolutely, use cases. Got to figure out, if I can do this in 60 seconds. So in order to build something, you need to know exactly what you're going to be sharing information about, but you need to put that in the context of real people and real situations, which requires a use case. So you have to agree on what this, to Karis's point, what are you solving for? And it gets very reductionistic, which is the need, but the only way you can get to it unless you have some magic. And that's really the hardest thing. The good news is we've spent the last couple of years building a very complex use case that covers all the SDOH categories and has been vetted a lot. So people can use stuff that's already been created to say, oh, I want to solve this problem, and then look for demos that have been done and proof of concepts. There's a lot of proof of concepts that are out there.
Thanks for that. We're going to unmute Elizabeth here, who's got her hand up, and we'll have time, I think, for this one last question. Can't believe the hour's gone by so quickly. Let's, there we go. Go ahead, Elizabeth.
Thank you. I am wondering, so there's the one issue of like having a way of uniform consent and like consent forms that talk to each other from organization to organization, but then separately, every different organization uses different data systems. So once you get the consent to share information, is there a solution to then what's the easy way to share that information, like a way that the different systems can talk to each other?
Great question.
Yeah.
Kate,
I mean, I was just going to say that, I think the traditional way that we've been thinking about sharing information needs to be evaluated. Usually when you start talking about, okay, I have this system and that system, the first thing they do is lay out data models next to each other and start mapping between this data element and that data element. And that takes forever. And it's just not the solution. In my opinion, I think there's a much easier way to go about this if we make it person-centered. If you begin to think about a person and a family and the information that relates to them, forget the system. You can simplify the problem. What you do is you write down, what is the question about the person in care and the family in care that I would like to know? And you work that up to the population question, and then you draw the data from the system to match that. Forget the data model, start person-centered and family-centered with the type of information that you would like to solve for and provide care for, and then make the data system work toward your family-centered model and question. Excuse me, I don't want to say model, your family-centered question. And if you do that one question at a time about that family, then you can catch that fish one at a time and not boil the ocean between different data systems.
Okay, thanks. It reminds us to put the youth and family first, which is, of course, the foundational imperative of everything we're doing. Can we give Karis and Daniel each 60 seconds to give us a summary? Anything that you'd like to reemphasize or talk about that we haven't talked about in just a moment or two as we wind up and finish at the top of the hour, Karis?
Sure. I mean, the only thing, thinking about children, families, and well-being, I guess in the question here, I know Lexi's on the call from YMCA, but the work and Steve's been working on with Partners in Prevention and the opportunities to really thinking about multi-generational families and supporting families in care. I think that's some of these use cases that Richard, kind of examples of initiatives that can be leveraged to like do information sharing, and to Kate's point around like an example of how we center around the person. I think that's where it makes it more actionable. It's a way to be able to do this work in a tangible way that then can be replicated. But I think that this is, that's kind of what we see as exciting opportunities in some of these local initiatives, and the investment in thinking about trauma-informed care and cultural competency, and kind of that awareness creates these opportunities to leverage these platforms to do that work.
Thanks, Karis. Daniel, final word?
Yeah, I'll make a little pitch here. So let's stop reinventing the wheel. Is the pitch I would make. And I just put into the chat a link for a training program we've actually created over the last bunch of years that actually tries to teach systems thinking. And it's a way for people who are doing this work. We've been doing it with the California Alliance and also with the National Association of Social Workers in California. We're going to introduce this curriculum to train people to be able to have people understand the systems level thinking, which you need to do in order to be able to use data and stuff like that. Anyway, I offer that up because it incorporates a lot of what I've talked about here today, but it becomes very actionable. And I'll say that we're also just about, as part of this, is also about to put out privacy and consent training module, one of the first of 2 modules to introduce people to the core concepts of HIPAA, FERPA, 42 CFR, sharing, all those kinds of things. It's kind of a foundational approach that builds on things. So there's a go-do there in terms of how do you take a next step. This is good for organizations. We've done this with the federal, state, local governments to help them create the model and the language to go do kind of what you showed up front in terms of those requirements, those 10 requirements. How do you go do it? So I offer that up for folks who might have interest in that.
Great.
Thank you. Steve,
If I could just, give a final word, and that is, let's not make it too complicated. With the partners around the table, draw a picture of the person and the family on a whiteboard or in your virtual whiteboard, and write down the questions that you wish you knew from the other partner about that family, and work from that model. And don't worry about the data models and the siloed systems. Begin with the family and the person. Ask the questions about the family, person you want to know, and then you can figure out where in which data system that information lies, and organize it around that child and family. Thank you.
Thanks, Kate. Richard, yeah, just that I hope everyone appreciates that there are multiple ways to address the data sharing conundrum that we've lived with for so many years. And we gave you 3 examples of people who are moving the needle on that. And I certainly urge you to follow up with the resources. And for me, the biggest takeaway is you want to think about the issues that you're trying to address and then let the technology follow that, rather than get stuck on trying to make the technology fit what you want to do.
Love that, Steve. Thanks for that. We'll send out links and papers tomorrow in our follow-ups to all of you who have joined us today. And Stuart and Daniel has pasted his Stewards of Change link. So please join us in a digital round of applause, appreciation for Karis, Kate, and Daniel, and for bringing forward their wisdom today. Thank you so much. Thanks again to our sponsors, and we hope that we will see you back over 8 weeks, a little under 8 weeks from today, August 18th, 3 o'clock. Join us for a conversation with some subject matter experts around how to blend the dollars and braid the money. Another critical effort here to build systems of care in California. Thanks again for joining us today, and we'll see you soon.
Stay well, everyone. Stay well.